All right, I got it. All right, so I'm going to just talk for a few minutes here about clinical trials. It's going to be more of a general overview, not about specific clinical trials, but hopefully everybody finds it helpful. So the first things I wanted to go over sort of what, why, and when to do clinical trials. And some of you may know, or most of you may know, that clinical trials are research studies that involve people. And through these trials, we are looking to find new ways to improve current treatments, find new treatments, and also improve the quality of life for people with lots of different types of diseases. Obviously, today we're talking specifically about ovarian cancer. Why would you want to consider a clinical trial? Clinical trials do give you access to new drugs that are not available as standard of care or through your regular insurance. There's always the hope that the new treatment is going to be more effective than the existing treatments. We do see that patients on clinical trials do get improved care. You get closer monitoring, you get more frequent access to nurses and physicians, and you really just, you get sort of a team behind you while you're on the trial. There are also women out there that participate in trials just purely for philanthropic reasons, hoping that they will benefit, but also hoping that, you know, their participation will help other women with the disease or, you know, future treatment for the same population. Why wouldn't you do a trial? And the biggest reason is that there isn't a trial that you're eligible for when you need it. The other reason would be that your physician thinks that the standard of care treatment is expected to be better than the ones that are being offered through the currently available studies for you. It may not fit your lifestyle, depending if you are trying to work full time. The study could also be in another state, or even a long distance away, and it just is not going to work. It may also impact your quality of life with more frequent schedule, side effects, that sort of thing. When do you want to talk about clinical trials? And the common perception is that when no further standard of care options are available, and this is one point I really want to hit home, and that's not when we want you asking about trials. We want clinical trials to always be in the conversation when any treatment decision is being made, even with initial therapy. And they should always be considered whenever the standard of care therapy is falling short of the goal of curing or treating the disease without substantially affecting your quality of life. So where do you go? Which one do you pick, and how do you find them? So for a lot of women out in the community oncologists just have a limited access to trials. So if you are lucky enough to live near an academic medical center, they will have a group of trials. There are NCI designated cancer centers that focus on some earlier phase trials. And then if you live here in this area, you know of the NIH, where they have a lot of different trials as well. So which studies? So it will always depend on what's available out there and what you would be eligible for ovarian cancer. There are studies that look at neoadjuvant treatment even before you've had the surgery, frontline or adjuvant treatment after you've had surgery, maintenance studies following either initial therapy or even further down the road. The biggest group is going to be for recurrent disease, and then there are also studies out there that are lifestyle type studies, quality of life, weight management, those types of things, or side effect management. It should always be a treatment decision between you and your doctor or your consulting doctor. I know we see people that come in for second opinions, and if we don't have a study, we interact with the local group and make sure that everybody is making the best decision for the patient together. It's always important to take into consideration the phase of the study, obviously the drugs and the side effects, and then the logistics of participating. So how are you going to do it? So you're going to talk to your doctor. Every time you're talking about treatment decisions, you're talking about the possibility of a change in treatment, you're talking about maintenance therapy, ask your doctor if there are any trials. If they don't have any where you are at, they can ask colleagues to see if there might be other studies out there for you. You can always seek out a second opinion at a center that's performing trials. There is clinicaltrials.gov, which has a search feature where you can put in some of your treatment history, your disease, that sort of thing, and find trials that way. And then there are a few matching services. So these are just a couple examples of services that are out there that try to match you with trials around the country. So these are just some of the frequently asked questions that I get working with clinical trials at Hopkins. Patients always want to know if they will receive a placebo, and the answer is if you do receive a placebo, you will know about it. You will never get a placebo and not be told that it's a possibility. There are a lot of trials out there that involve a specific drug or multiple drugs and then the possibility of placebo, but you will always know sort of what percentage of people will be receiving it. You will not be, unaware of that. What does it mean to be randomized? Basically, randomization is the flip of the coin. So it is when you are participating in a trial and there are multiple arms, you will get, the coin will flip anyway. So if there are two options, it is literally like a two-sided coin. There are studies that weight certain arms more. So, maybe it's a 3-to-1 randomization or a 4-to-1, and it really will vary, but that will be discussed with you while you're being looked at for the clinical trial. What is blinding? Blinding means that sometimes we are blinded to whether or not you are receiving drug, and this goes back to the placebo. And in some cases, we are blinded and you are blinded, and then in some cases, actually, the pharmacy is blinded as well. We are giving you your drugs based on like bottle numbers instead of, drugs, and that's in order to keep the quality of the trial as clean as possible. How long will you be in the trial? Some of the trials in the beginnings, like neoadjuvant or adjuvant treatment following surgery, it could be a set number. Maybe it's 6 cycles. Maybe it's 3 before surgery and 3 after surgery. Maintenance studies can sometimes be for a year or 2 years. Most of the recurrent studies are open-ended, so you will be on the trial as long as it's working for you and you're not having side effects that we wouldn't want you to continue the trial. Why are the eligibility criteria so rigid? And this is basically to keep the cleanest data possible so that we can get the better drugs approved quicker, so we can get more access for patients. And so it can seem very strict when you're looking at trials, but it is very important. Who pays for the study? Will I have to pay? Does insurance participate? And most insurance companies do cover clinical trials now. Medicare covers clinical trials. Whenever we have a new patient coming in for a trial, we tell their insurance company that they're interested in participating. We tell them what is covered by the clinical trial. We tell them what they will have to cover, and then we'll explain to you what you would be responsible for as far as co-pays, deductibles, that sort of thing. Risks of a trial are largely dependent on the drugs that you're getting and any other type of treatment that may be involved. That will all be discussed with you before you sign the consent form. And then how long does it take for a drug to be FDA approved? And unfortunately, this is a long answer or too long of a time, but this next slide, you'll see sort of this drug development timeline, and it can take over 10 years to get a drug to approval, which is too long. And so what we really need to help improve this number is to get more women participating in clinical trials. So I hope that you will go out there and talk to your physicians about it. And then I'm going to turn things over to Alana.